We've been 3 years now, maybe even more now, into this. We realize the importance of having conversations that we can place sources of health information into people's hands. At this point, we've seen that there's been a lot of divisiveness in terms of, who is pro-vaccination, who is against vaccination. And there's also a lot of uncertainty in terms of, what do I do? What is my next step? What do I need to do? So today, what I'm going to do is just some basic skills to help in kind of connect with people. How do you start to sit down at the table to be able to have these difficult conversations and put important information into people's hands? Next slide, please. These are just some disclosures about my work. Next one. So the first objective for this didactic is so that you can learn some of the practical skills that you can use to communicate your health messages more effectively and to learn to relate to people and help people feel validated. And the second objective is to increase awareness as to what effective communication looks like in the community in your everyday life. Next slide, please. So, background and significant. I don't think I have to provide you with a lot of this because a lot of you have been in the trenches. A lot of you have lived with this. We get your feedback all the time saying, I'm tired. The community keeps coming to me with information. And sometimes I'm even confused myself in terms of what is the information to provide to them. So hopefully these sessions will help to clarify some of that uncertainty that you might be experiencing. Next slide, please. We know that miscommunication and myths have been prevalent throughout the pandemic, and even though we're still 3 years in, there continues to be a lot of debate. People are asking, should I continue to wear masks when I don't see anyone else around me wearing masks? Where do I go for a booster? If I got COVID-19, do I need a booster? How long do I need to wait? A lot of these things sometimes lead to myths, to something that someone made up and try to put it there as reliable information, and the community feels very confused. We also know that there are many compounded barriers in terms of accessing needed health information or finding the right people to talk to. We know that, unfortunately, a lot of our historically marginalized communities have a lot of mistrust that is grounded in our past experiences. And some of the recent rhetoric that we've seen, grounded in discrimination, in racism, in fear, in fear of our information being manipulated. And a lot of our people have difficulties accessing technology, particularly if we think about our oldest member in the community. Also, our communities vary so much. They're very heterogeneous. We have people of different ages, of different backgrounds, and that is important to consider because all of the skills that we'll be talking about today need to be tailored to different audiences. And then your own demands, your own need for self-care. Next slide, please. So it is important to take a step in the right direction and to try to do our contributions. All of you do it. This is why you are community health workers and health promoters. It's in your hearts. It's part of your mission. It is a moral issue that pertains to social justice, and it is timely. If we don't do it now, when? However, I have to emphasize that it is also important for you to take care of yourself. Because if you don't take care of yourself, it's going to be difficult for you to provide the care that other people around you need. Next slide. So let's begin by thinking about our competence. Sometimes we think, I belong to this community. I know everything about this community. I'm Latino. I speak Spanish. I've been embedded in this. I know it all. And the fact is that not necessarily. It's very, very difficult for us to know everything about someone else's family's context. So it is important that we acknowledge that there's limitation, that yes, we might belong to the same group, yet we might not have all of the answers. So in that, we need to adopt a humility approach in how we interact with people. and often take the time to listen to people's stories, learn about their culture. Latino cultures in different populations, we have a wealth of different backgrounds and beliefs and perspectives and traditions. So it is important to learn and to get to know what people are facing. Same in terms of the context. We don't know what their life experiences are. What are some of the dynamics that they take place in their families? So it is important that we try to leave our assumptions aside and we invest in listening and learning about people. It is important to know that you're not alone in doing this kind of work. Build your networks, relate to other community health workers, ask them for help, consult among themselves, and if not, consult with also the health professionals that are behind you. I know several excellent people at UT Health that are there, that all you need to do is to reach out to be able to put some of this information in your hands. It is important also for us to develop self-awareness in terms of what are our own needs, what are our own biases, our own needs, our own fears that we might have, because they will come into play in how we communicate to the people. Next slide, please. And most importantly, I cannot emphasize enough the importance when you go in to talk to people that you consider what is your approach going to be. Is your goal to empower the families that you work with, or is your goal to impose your own views, to impose these sources of information that might not sit very well with the family that you're working with? So I strongly emphasize you to consider an empowering approach. And what I mean by that is that you become the vessel that puts resources into this family's hands, that put information into their hands so that then they can make their most informed decision. Because by telling someone you're supposed to do that, you should be doing that, or in some instances, probably unintendedly shaming them about not having engaged in a behavior, just a simple question like, you're not vaccinated? You're not vaccinating your kids? Really? That can put people down. That can help. That can make a person feel very, very bad about themselves. And that's not your goal. That's not going to move your conversation forward. So your goal should be to empower. And empowering will vary depending on our personal style, depending on what we know, depending on our own experiences with others. So in the next few slides, I'm going to give you some tips as to what you can use. What are some of those tools that you can use to empower the people around you? Next slide, please. And a lot of this I have learned from you. We as providers learn from listening to you. You have a wealth of knowledge. So any questions that you have that you bring to us, we also learn from you. So a lot of the information that is that I'm going to present to you, you gave it to us. So the wealth is there. It's just a matter of us sometimes remembering, because it's so easy to forget that we have these gifts with us. Next slide, please. So I love, for those of you who are not familiar, I'm a psychologist. So Carl Rogers I'm the biggest fan of. He was a very, very famous psychologist, the father of humanistic psychologists. That it always talks about the importance. You can do wonders and try to have all of these skills to do in therapy, but if you cannot build that connection, if you cannot sit with a person with authenticity, with genuineness, with an ability to put yourself in their shoes, whatever you do is not going to stick. It's not going to stay. It is going to be that personal connection that you can build that is going to take a lot, and it's going to make a lot of the difference in empowering these people to take action. Because then they feel that they have someone they can trust. They feel someone that gets them, that understands them. And if maybe not at that moment, but maybe later on, they have questions, they will come to you because you already built that bond. So it is important for those of you who haven't read to read about his work. It's fascinating, and it teaches you a lot of how do we build humility when working with other people so that we can create stronger bonds that eventually leads us to communicate and get them in the right direction to engage in the behaviors that they can engage, that they need to engage to improve their health outcomes. Next slide, please. And the first and more important skill is think about your body language. How do we use our body language? What is the tone of voice that we use when talking to people? Do we tend to have a condescending tone to people? Do we tend to talk to them down, like we are the experts and they are at a lower level? Or do we try to take a communication, a collaborative approach that allows us to become partners in this process? It is also important to listen to people. We're very good at giving advice, but not so good often at listening to people. Sometimes we feel uncomfortable with silence, but silence can do beauty to give a stage to people to be able to come up with questions. And a lot of the times when it's about giving advice, we just talk, and we forget to listen. So it's important to develop those skills that will help us listen to each other. Smile. I cannot tell you the power of a smile, how strong it is. Even when someone is complaining about something, of course, you have to be a little careful not to look like you're laughing at them, but just a kind, gentle smile. Your eyes, you can convey so much with your eye contact. So don't underestimate any of those powerful gifts that you have within yourself to be able to help people feel safe and feel at ease so that you can provide that environment. Next slide, please. It's also important that you become informed about the dynamics, the cultural norms, and the value of the people that you work with. And I can give you an example of this. I was asked to work with a Southeast African refugee community, a Muslim community, to try to provide them some psychoeducation about how to take care of their health. And I knew nothing about this community. So it could be easier for me to say, oh, I can't do that. I don't know anything. I don't feel comfortable. I don't know what's appropriate to say or not. But there was no one else at that time to be able to do that kind of work. So instead, what I did is I consulted with their community leaders. I went to them and said, teach me about your culture. Teach me about what are some things that I can say and some things that might be inappropriate, even to the point that what should I wear when I meet with them? So it's about that sense of humility that if you learn about that culture, then you can go and do it. And of course, always disclosing, I am new in working, but I bring my heart and I bring what I know so that we can work together to move forward. Try to minimize distractions. Is very, very important that when we're with someone, the other person can feel that we're fully present with them. Turn off your cell phones or put them in silent mode and put them away. There's nothing more disrupted than be having a heart-to-heart conversation and all of a sudden a phone or a text message beeping comes up. It completely disrupts the dynamic. So help the people feel that you're 100% there for them. And that's going to get you a long way. Maximize privacy. Ask people, find the right time and the right place for the conversation. If there's people around, you can ask people, do you feel comfortable here? Or do you prefer a more private place? Don't assume that that's going to be okay for the person. Even within their own family, sometimes people just prefer a private conversation. So always ask. Listen, I already talked about that. And try to make sure that you're not rushing. It is terrible. And I know we all have busy schedules and appointments back to back, but it can create a lot of hardship and it can create a lot of hurt feelings if you schedule someone and says, oh, I'm sorry, I have to go. I cannot listen to you anymore. So make sure that when you do, you're going to spend that time with that person that needs it. Next slide, please. So in terms of verbal considerations, it's important to convey interest in what the other person is saying. And a lot of the times using validating phrases such as, I hear you. I'm trying to understand you. It is very important what you're saying. Or using mirroring techniques, for instance, saying, let me try to see if what I'm understanding you correctly in what you're saying. You're saying that you're afraid of getting the vaccine. Can you tell me a little bit more about that? So those are some basic techniques that you can convey your interest, making sure that you're understanding what the person is trying to convey to you, but always make it from your perspective. Sometimes, even if you're not fluent in the language, try to learn a few words in that language so that people can relate more. Some people, to me say, well, I don't speak Spanish. How can I go and help? There is a need. So anything will be very helpful, but try to learn, for instance, buenos días, gracias, ¿cómo está? All those things will put people at ease. We learn, and I don't know if you remember this, Raquel, I think in one of our focus groups, we learned from when we were asking people, in what type of interactions do you feel more validated? And one of our participants said, when there's an English speaking trying to come and talk to me, even when they don't speak Spanish. That's right. And the reason why they say is that because I feel they care. I feel that they want to try. So don't underestimate the power of you trying to work with communities, even you might not be fully proficient at it. It's okay to not know everything. It's okay to say, you know what? I don't know. That's a very good question. But now that we're working together, we can find out together. Let me go and find out and come back to you. You do not need to be an expert in everything. Even if you're talking about COVID vaccine, because things change so much, just make sure that the information you provide is valid and it is reliable. And get their feedback. As you're going through this talk, and particularly pay attention to their body language, ask them, how are you doing? Are you okay with the conversation? Are you feeling at ease? Do you want to take a break? Do you want to take some time? Let me know how you're feeling. And at the end, I always ask people for their feedback. You're going to learn so much about your own interpersonal style and about people just by asking for their feedback. How did you feel in the conversation today? Did we do okay? Is there anything I can do to improve how I do my work? Some people feel intimidated by doing that, by asking that question, but actually it helps build connection with the community and people feel that they can trust you. Next slide for the sake of time. When you're trying to assess what the person asks, always ask them, what is your goal? What do you hope to get out of our conversation today? It's important that you start by that, asking them, what is your goal? What do you need from me? Don't pretend that you know what that person needs, because it might be different. Try to assess what are some of the things that are getting in the way of this person or this family getting the information that they need. And what are some of the things that help? What have been their experiences navigating the healthcare system? Have they had trouble? What are some of the resources that they need? What are some of the things they have in hand that could be helpful? What are some members of the family that could help make those connections easier? Next slide, please. When you're actually doing the intervention, and what I mean by that, when you're actually trying to put the information in their hands and motivate them to take action without imposing, again, by empowering people, the most important thing is to ask people, what are your beliefs? And to counter misinformation, but be careful not to put people down. So if they come up with some strange belief that you in the back of your mind are like, oh, I'm not listening to this. This is not appropriate. You can say, I hear you. Where did that come from? Where do you think that belief comes from? May I share with you another way of thinking? But always ask for that permission from the community. Try to put in their hands resources, but be careful that those resources are what we call culturally and contextually sensitive resources. And by that, I mean, for instance, take a look at the brochures. Make sure that the pictures in those brochures look like the people that you're dealing with. Run them. If they in another language, go to someone who speaks that other language and says, is this appropriate language? A lot of the time we assume that just because they have been translated that it's good language, and it's really not. And sometimes it can be offensive. People feel marginalized if you show them a brochure that doesn't look like people like themselves. Try to use simple language. Let's try, sometimes it's hard for us as academics to forget and use big words. And here we are talking about cognitions, and when it's just thinking, cognitions are thinking. We use fancy words for simple everyday terms. So how can we tailor our language to communicate to people in a simple manner? And very important, keep an open door, but do not overpromise. Remember that you have also a very busy schedule and that you have your own life. And that if you overpromise and then people come to you and there's a time when you can do it, what's going to happen? It's going to create mistrust, deceit, and distance. So also be aware of your own limitations and boundaries. Next slide. Next slide. And these are just, if for instance, I know many of you are community leaders, so a lot of the skills that I talk to you about is when you're working in one-on-one communications. But this slide is more about when you're giving a talk at your church, when you're giving a talk at a community center, what are some of the things that you can do? And I would say the most important thing, find out who the most powerful people in the community is, and then walk side by side with them. Ask them to share the talk with you. That will increase your credibility and access. The other one, I learned this from a fascinating reading not too long ago in working with communities that have been historically marginalized. There's two ways to approach these communities. The first one is by taking a reparation approach. And what I mean by that is by acknowledging the harm that has been done. By acknowledging that these communities experience mistrust, for instance, as a result of deceit that has happened in the past, as a result of being marginalized in terms of how we provide information, as a result of probably not having enough culturally sensitive providers. So by acknowledging where the community is at, by acknowledging the community's fears and validating and saying, it makes sense. Of course you're feeling this way. And then take an instrumentation approach. And what I mean by that is, how do we create a change? We know that damage has been done. How do we move forward in change? You are essential to make a change. So that's when you make the switch and help people feel that they are needed. Everybody is needed to get out of this pandemic. Every little thing that you can do, every little thing that you can learn to get us closer to getting out of this pandemic is going to help everyone. And this is why we need you. I know your communities have been hurt, but we need to have you on board. Appeal to cultural values. For instance, I'm of Mexican origin, so the power of collectivismo and familismo is so strong. So appealing to the family. Do this for yourself and for your families. Provide this information for yourself and for your families. You can make a difference. If you are okay, those around you that you love are going to be okay. There's so much power in finding what are those cultural values that resonate with the audiences that you talk to. If possible, make the talk interactive. Ask people to participate in it. Help them ask questions. And allow extra time to stay afterwards. There's a lot of people who are more shy or introverted. Stay, just hang out and see, give people a chance to get to know you and ask you questions. Next slide. So what are my takeaways before we move to our case? Communication extends beyond language. There's so much. It's about the meaning. It's about your body language. It's about your disposition. It's about your competence. So pay attention to your inventory. What are those things that you still need to work out so that you can provide this information? And, sometimes we're afraid of looking into black boxes because we don't know what they are and they can be intimidated. Be willing to step in, take a look, but always think creatively how you're going to work with these things. And our clients, our patients, our communities needs us. or each of us. We need to work together to make a difference. Next slide. And with that, we open it to, I guess, the case and then questions, but thank you very much.